breast lift is an operation where we're shaping the breast. So we're taking a breast that has either through aging, through pregnancy changes, or just genetics. A breast has some sag or some hang to it. The nipple position may be a little bit low and not in an ideal position. So a lift is really an operation where we're shaping, we're adjusting the shape of the breast, we're adjusting the contour of the breast, the nipple position, often decreasing the areola size and adjusting that to a more aesthetic size. But it doesn't add any volume. So the difference between a lift and an augmentation is the volume of the breast. So a lift reshapes a breast and an augmentation adds volume. And often we're doing both. A lot of times we're adding an implant and then doing the lift in one operation to enhance the aesthetics of the breast. So good candidates for a breast lift are patients that have some sag or some hang. So the nipple is no longer at the apex of the breast. The nipple is starting to trend down or pointing down. So there is the pencil test that patients can do at home. This is a quick and easy test where if you can support a pencil on the underside of the breast, that means that the breast has enough sag or hang where a lift is going to be beneficial. That means there's enough tissue and skin hanging below the bottom crease of the breast, and so we can do a lift to be able to reshape that breast, elevate that tissue, elevate that nipple position into a more aesthetic position. Am I going to lose all the sensation in my breast or my nipple? And the answer to that is generally no. We leave the nipple attached, we don't take it off and put it back on, so all of the nerves are still intact. There sometimes can be some decrease, but it's less common. Another question that patients have is, well, how long does a breast lift last? And so unfortunately, we don't set patients in stone. The body will age, we'll reverse that aging clock, but the clock will continue to tick forward. So a good lift will last about 7 to 10 years. A lot of patients will come back after a decade or more and have a lift revision, and that's not an uncommon procedure that we do on some of our patients. Another common question that patients have about breast lifts are the scars, and so we can't do a scarless breast lift, unfortunately. The scars are generally very minimal, and scar can be something from just a donut scar or 360 around the areola to a lollipop, 360 around the areola down the front of the breast to the classic anchor scar. And the incision really depends on how much extra skin there is. So it's dependent on the anatomy of the patient, not as much on the surgeon's favorite incision, for example. Is it okay to have children after a breast lift? And generally, like a mommy makeover or a tummy tuck operation, we generally want patients to be done with family planning. Can you have a child after having a breast lift? Absolutely. But there may be some changes that will happen with the breast over time. And it just depends on the individual. Some patients will have minimal changes, other patients will have more significant changes. So some of it depends on the individual genetics of the patient. But in general, the ideal time is after having children. That's a great time. If you have any additional questions about a breast lift, feel free to give the office a call or fill out the scheduling form below. We'd love to sit down and talk with you.